Feeling sad or low at times is a normal part of life, but when these feelings don't go away and when they stop us from enjoying our usual activities or cause us to withdraw from other people, it might be a sign of depression. Depression can leave people stuck in a spiral of very negative thinking that can be very difficult to get out of. In this state, there's a biological change that someone is experiencing, influencing their thinking and their behaviour. It's not something that they can just talk themselves out of, but with the right support and treatment, which can include therapy as well as medication, they can get through it. What is depression? Depression is a mental health disorder defined by core symptoms of a depressed mood and a loss of interest or pleasure in life for prolonged periods of time, persisting for anywhere from several weeks to several years. It can cause a significant disturbance in a person's life and functioning, affecting their sleep, appetite, and social interactions, making day-to-day activities extremely challenging. There are 3 main types of depressive disorders. People may experience an episode of depression, which can be a single major depressive episode, such as postnatal depression, or they may experience recurrent episodes. There's also a more persistent, lower-level depression called dysthymia, which is less severe, but much more chronic and can go on for several years. And then there's the bipolar presentation of depression, which occurs when a depressed mood alternates with manic-type symptoms of very high energy and exaggerated sense of self-esteem. What are the signs of depression? People can experience depression differently. Signs of depression can include changes in personal hygiene and loss of interest in self-care, changes in sleep, either sleeping more than usual or insomnia, changes to appetite, either not eating or overeating, reduced interest or withdrawal from social activities and connection, low self-esteem and a feeling of worthlessness, poor concentration, low motivation, and low energy levels. When somebody has been depressed for a long time, they may also engage in more risky behaviours, such as substance abuse or experience suicidal thoughts. For a young person, these aren't simply normal teenage changes. Instead, they are very significant and obvious behavioural changes. In adolescence, their external expression of their mood can vary, so they can go from feeling low to becoming intensely agitated. They may spend a lot more time in their room and stop doing the activities they usually enjoy. Depression can sometimes be more difficult to pick up in adults, particularly if they're living on their own without people around them to notice changes in their behaviour. How is depression diagnosed? Depression, like many mental health problems, can take a long time to be diagnosed. People can attribute a depressed mood to a number of factors, such as a stressful life change or experience of an adverse event. The symptoms of depression on their own are normative. We all experience low mood or grief at times, but when it begins to interfere with our lives or impact on how we function, and when it co-occurs with physiological changes such as weight loss or weight gain, then it can be a sign that it could be depression. Depression can be diagnosed by a GP. They can provide a referral or a recommendation if they believe psychotherapy would be beneficial for you. You don't need to wait until the signs of depression are very extreme before you talk to somebody. Early intervention is critical and leads to far better outcomes. For parents of young children or teens, it can be difficult to know when to seek help. But while there might be pushback or irritability in kids, it's not normal for young people to experience significant changes in mood or behaviour, or to withdraw or lose interest in life. Without support or intervention, these feelings can escalate quite rapidly. If something doesn't feel right, it's a good idea to talk to a GP early. What causes depression? Depression varies greatly from person to person. It's influenced by social, psychological, and biological factors. Genetics and family history plays a role, as does a person's temperament, personality, and psychological capacities. External factors are significant contributors. People may have experienced a loss or trauma or some other adverse stressor that can lead them to experience depression. But people can also be more vulnerable to depression because of their family history, genes, and temperament, so might experience depression without a major adverse experience. Sometimes depression is not the primary condition, but a consequence of other health conditions or personal stresses. Long-term health conditions, illness or injury, or other mental health disorders such as anxiety or OCD can reduce somebody's ability to engage in the things they previously enjoyed and lead to symptoms of depression. Depression can be cumulative, and a series of events might have a negative impact over time. Low-level, persistent stress, for example, if a child doesn't feel like they fit in at school, can lead to depression. While depression can be seen in young children from around 8 years of age, we see a real spike in depression during adolescence. Teenagers can be particularly vulnerable to depression as they move from middle childhood towards adulthood, and expectations of them and the stresses they experience can change dramatically. How do you treat and manage depression? Early diagnosis and intervention can help people overcome depression sooner and provide them with strategies for managing the stresses that might trigger depression in the future. There are two main treatments for depression: psychotherapy and medication. Either can be used alone or both in combination. Because of the biological component of depression, antidepressant medication can help people get out of their negative thinking spiral, which can make therapy more effective. Cognitive behaviour therapy, or CBT, has the strongest evidence available for treating depression. CBT for depression looks at cognition or thoughts, as well as behaviours and actions. It focuses on an awareness of feelings and a connection between how they influence behaviours. It also involves identifying unhelpful thoughts and challenging them with more helpful or rational ones to reduce symptoms of depression. CBT for depression has a focus early on in treatment, targeting withdrawal from social interaction, encouraging people to resume activities they may have stopped, even if they don't enjoy them right away. Overcoming social withdrawal is one of the most challenging things for a person with depression, but its effects can be quite profound. Interpersonal therapy, or IPT, is another form of psychotherapy for depression. IPT emphasises the importance of relationships and the impact they may have on how we feel about ourselves. Through IPT, people gain a better understanding of their feelings and how they respond to different interactions, which help them to increase their social skills and their functioning. Can depression be prevented? All feelings are normal, including sad or angry feelings. So it's more important to be aware of them and know how to regulate them so that they're manageable rather than preventing them entirely. For families and young people, being psychologically minded, aware of feelings, and having a good vocabulary to discuss them and talk together to work through them can really help. Being able to talk together as a family about problems, stresses, and how we manage them, rather than internalizing negative feelings like guilt or shame, can help build a resilience and help us to be proactive about approaching problems rather than avoiding them. Social connectedness is very important, and we know that isolation and loneliness are critical predictors of depression. Giving young people the language to talk about their feelings and instilling help-seeking behaviours in them so that they can reach out when they need it before things get on top of them is one of the best things we can do.